Hello, thank you for joining me. My name is Anil Tailor. I'm a consultant gynecologist and I practice in the UK. Today I want to talk about the differences between cervical precancer and cervical cancer. It's an important difference, especially in the context of cervical smears. Especially when we think about what we're trying to achieve with cervical smears. So essentially, a lot of women wrongly assume that what smears are trying to pick up is cervical cancer. That is actually wrong. What smears are trying to pick up is cervical precancer. And so the difference between the two is important. Now, if we consider somebody who is unfortunate enough to have developed cervical cancer, then at some point in their life, of course, they were normal. So they would go from a stage where they were normal and develop a cancer at some point in their life. Now, before they develop that cancer, they will go through a phase when it was a pre-cancer. And that pre-cancer phase can be a fairly prolonged affair, anything from 5 to 15 years sometimes, for that pre-cancer to eventually develop into a cancer. And so that is the phase that the smear is trying to detect. If we to understand the difference between the two, let's look at the anatomy in slightly more detail. So we have here a womb, and if we were to magnify this portion, meaning the cervix, we have an area on the cervix which is where precancers first start. And if we were to take a cross-section of a little tiny area of the surface on the cervix, then in a normal individual, we would see under the microscope layers of cells. So this is the surface and this is the under the skin, meaning so all the fat cells and all the blood vessels and nerves would be in that area. So in a normal individual, all the cells are ordered in that fashion, and when precancer starts, it starts at the bottom layer, and as the precancer progresses, there are more and more of the abnormal cells, until at the worst point it sort of covers the entire layer of the surface. Now, the next phase is obviously the precancer cannot go in that direction, so it then bursts through this layer, and that's what a cancer is all about. So the precancer can be graded into low grade and high grade, and so the low grades are the ones that in the UK they are described as borderline or mild smears, and the high grade smears are those where the abnormality is said to be moderate or severe. So all this is still precancer, and the transition from precancer to cancer can take many years. And So that's the importance of cervical smears. They are trying to detect the abnormality when it is still a precancer, because when it is treated at that stage, the treatment is really, it takes only about 5 minutes under local anesthetic. Not all precancers need treatment, only the high-grade ones require treatment. The low-grade ones can simply be monitored. So that's precancer. So what is cervical cancer? Now, cervical cancer is staged. Now, staging means how far has the cancer spread? And so when it is at the very earliest phase, meaning still only microscopic, that is in the old staging system. So there is a newer staging system, but the old one will serve our purposes for explaining staging. So when it is still in the microscopic phase, it is said to be stage 1A. When it becomes slightly bigger, but still confined to the cervix, it is stage 1B, and it can be divided into stage 1B1 or 1B2, depending on the size of the lesion on the cervix. Now, if the lesion were to spread onto the adjacent vagina, then it becomes a 2A. But if it were to cross into the ligaments supporting the cervix, then it becomes a 2B. And if the cancer were to spread all the way to the pelvic side wall, then it is a stage 3B. And the last stage is stage 4, when either it has traveled to a distant organ like the lungs or the liver, or it has spread into either the bladder or the back passage. So that's also stage 4. Now, the reason staging is important is because it will determine the treatment that the patient will receive, whether it will be surgery or whether it will be chemotherapy, radiotherapy. And of course, for obvious reasons, the stage will also determine the prognosis. And so that should hopefully explain to you the difference between cervical precancer and cervical cancer. Cervical precancer can be very easily treated, takes 5 minutes, whereas cervical cancer requires very heavy-duty treatment, and obviously the purpose of cervical smears is to pick it up in the precancer phase when it can be easily treated. So that's all I want to say for today. I have many other videos on a similar topic. Please go and search them out. If you find these videos helpful, then please consider subscribing or clicking the like button. Thank you very much, and until next time, please stay safe.